morning, everyone. I am Kelsey. I have never presented virtually. I think therapy is so hands-on, and if you've ever seen me present, you know that I love people to interact and participate. So I would love for y'all to still do that, and we'll see what we can do and how we can teach you and your loved ones to be safe at home, even if we have to meet virtually today. So, um, Tim, are you my clicker? Perfect. Here are some things about me. Most of this was highlighted in my introduction. So I am from Memphis. I went to the University of Arkansas, Woo Pig. Went to Belmont for my doctorate, and then I was a travel OT both in South Carolina and California. So I got to see a lot of businesses work, what works well, what doesn't work. And then I fell in love with home health. If When I started OT school, I thought I wanted to work with pediatrics. And then I realized what a day working with kids felt like, and I was exhausted and ended up falling in love with older adults. Specifically, I love the home health setting because if you see a patient in like the hospital or in rehab, if you ask them what their goal is, it's always, I just want to go home. I just want to go home. So when you actually get to see them in their home, they are really pleasant. They love seeing you. So I have fallen in love with home health. I worked for Vanderbilt Home Health, which was really streamlined. I love Vanderbilt. Everyone went from their hospital to their rehab to their home health agency. And then when I moved back to Memphis, I realized that things weren't as streamlined because we don't have any hospital owned home health agencies here. We don't have any locally owned agencies. They're all owned by businessmen in Vegas or New York. So I have loved just learning to see what it looks like to create something local here. Other interests of mine, traveling. When I launched 901 Home Health, I went to Australia for 3 weeks solo and was just like, well, this is the last time I'm going to be able to have free time. And so I did that. And then I love working out. I love quality time with friends. If you have ever had a one-to-one with me, I always sit down with a glass of coffee or at night, a glass of wine and say, tell me your life story. I want to know everything about you, which if y'all have ever done BNI, a lot of one-to-ones led to me dating the handsome man in this picture. And then I just love mentoring younger girls. So I help out with the youth group at Grace Valley. And I think that love of mentoring others is was one of the reasons I love like the ownership management of my business is because I love teaching others how to be a clinician, teaching others how to love home health and to love people well. But ultimately, what this is all about is I love the aging population. You can see me with one of my nurses. Oh, one more to the left. Sorry, Tim. Well, that last picture was just me at one of our patients' 100th birthdays, and he's still kicking today. So we love older adults. Next one. All right, so why 901 Home Health exists? When I moved to Memphis, like I had said, all of the other home health, there's about 15 home health agencies in Memphis, all owned out of state by a non-clinician. So even names that sound local, like Baptist Trinity Home Health, isn't owned by Baptist. Methodist Alliance isn't owned by Methodist. Tennessee Quality Care isn't owned in Tennessee. So when I moved here and I joined one of these large corporate ones, I just saw so many things fall through the cracks that I was like, well, is there a small kind of like mom and pop locally owned agency here? Everything I just compared to Vanderbilt, which was so streamlined and it didn't exist. So I decided to create my own. And so I got to handpick my dream team of clinicians. So I called the very best physical therapists I knew, the best nurses that I knew. And I went to the Tennessee Health Facilities Commission and said, I think we need a new home health agency. When you do this, anyone that is a competitor can oppose your project. So about this time last year, I went to court against, it was 9 men in suits who got to decide whether I existed or not. And it was me versus a $6 billion company trying to get approval. And the $6 billion company was opposing me, saying, we don't need another home health agency in Memphis. And I got to talk about all of the things that I saw fall through the gaps and had the support of a lot of local physicians. And that was a picture of me when I won that case and got permission to start 901 Home Health Care. So I just love the idea of being locally owned so a patient has a say in their care. I love my clinicians. If they have a concern, they come to me. If a patient's rude to them, we don't see them. If it's a home that we don't feel safe in, we don't go. And that is the kind of just independent and personalized care that you get when your owner and manager is right here with you. You can go to the next slide. All right. So, I think my PowerPoint is a little bit off. It's supposed to be home care on the left and then home health care on the right. Anyways, This is $1 million question that I get a lot of. I get calls all the time that's like, you would be the perfect person to sit with my loved one. I love your personality. And that is not what we do. That is when I send people to Tim. We do not do caregiving. We do not do non-medical services. So the left side is home care, which is assisting families with caregiver burden. It doesn't require a doctor's order. It's non-medical. So these are just caregivers who would come and sit with you, help with things around the house, take you to your doctor's appointments, exactly what Tim was talking about with home helpers. It's almost always out of pocket. Sometimes long-term plans help with it, but it's usually about $30 to $35 out of pocket because it's non-medical. We work hand in hand with them a lot. We are not competitors. We refer to each other often. So the right side of the screen, you'll see home health care, which is what we do. So we do rehab at home to increase your strength, your independence, your balance. We do require a doctor's order, so we can't just show up at your house. Any doctor who has seen a patient within the last 90 days can send us that order. And our team consists of nurses, physical therapists, occupational therapists, which is what I am, speech therapists, social workers, and a home health aide. Our home health aide goes into a patient's home for about 30 minutes to help with the bathing and dressing routine. So again, we touch the patient, not the home. So if a patient has needs outside of this, then that's when we refer to that non-medical home care agency. We are there short term, so usually 2 to 3 visits a week for 60 to 90 days. We don't last forever. And the good thing about us is we do get to bill insurance. So I don't have to talk about money to patients. We bill straight to their insurance. Next slide. So this is kind of our dream team. So I always say that we're better together. None of us can do everything, but together we can do most things. So when you get a home health order, any of these 6 clinicians can come in. Some of our patients, maybe they had a knee surgery and they only need physical therapy. Then some people have had a lot going on, so they would benefit from all 6. So our nurse would go in and look at the medications, look at skin to do wound care, and then do disease education. So, do you know why you had a stroke? Do you know why you had a heart attack? Are you managing your diabetes? The OT, which is what I do, we work on ADLs, which is activities of daily living. So, bathing, dressing, toileting, eating, any kind of home modifications. So, our goal is to work on that independence and safety. Our social worker would look at transportation, meals, any kind of additional community resources that that patient needs. And then they also have those end of life conversations. So when those needs are beyond what home health can offer, hey, can we help you transition to hospice, which is not something that we do. We would transition them to an outside hospice agency, skilled nursing facility, memory care, whatever is next for them. Physical therapist works on mobility, gait training, so walking safely. Speech therapy works on obviously verbal and nonverbal communication, swallowing, and cognitive retraining. And then that home health aide, like I said earlier, assists the family with the bathing and the dressing routine. So the next thing that we're going to do is I'm going to say a case study. I'll read this out loud, and then I want everyone to unmute their screens. And we can, after I read this, we can go back to the previous slide. And I want to talk about what each clinician might do. So here's our case study of Miss Smith. She is a 71-year-old single female who has always considered herself Miss Independent. She's never been married, never had kids, and continues to work full-time as a college professor. She independently keeps up with her 2-story home, in which her luxurious master bedroom, of course, and bathroom are on the 2nd floor. Outside of work, she enjoys volunteering at her church and going to Zumba at the local YMCA. She's always been extremely healthy, never taking more than a vitamin. One day while teaching, she began to lose her balance and slur her words. She was very dizzy and quickly collapsed. EMS brought her to the hospital, and she was diagnosed with a left cerebral vascular accident, a left CVA, which is a stroke. The hospital addressed her immediate needs and sent her home 3 days later with home health orders and a list of new medications. She now presents with slurred speech, right-sided weakness, because a stroke is going to affect the opposite side of your body, and poor ambulation. What does each discipline do for Miss Smith? So we can go to the previous slide, and I would love y'all to talk. So what do you think our nurse would address with Miss Smith after her stroke?
I would say definitely mobility training.
For the nurse?
Oh, for the nurse. I'm sorry.
Let's start with the nurse. So we're going to go
okay.
left to right. So what is the nurse?
Medication administration.
Yes. Remember, Miss Smith has never been on a medicine before. So medicine, what else?
Disease education about why she got it, why
Why
she
did,
is in the position she's in.
yeah, why did she have a stroke?
Uh-huh.
Good. Okay, OT. This is my bread and butter. What do you think the OT would do with Miss Smith?
Teach her how to safely bathe and how to safely get a transfer from
Yeah.
sitting to standing and things like that.
What is the most concerning about her home environment? Do y'all remember anything?
Her
Probably
bedroom
second
upstairs.
story bedroom.
Yep, everything's upstairs. So we either have to modify something downstairs or we've got to train her to get up the stairs or get a stair lift or something like that. What about that right-sided weakness? What would that look like for OT?
May have trouble reaching some of the things that are higher. She
Yeah,
may have to figure out how to position herself so that she doesn't lose her balance when she's on her weak side.
good job. Yep. And we also do a lot of like one-handed techniques. So even if they lose control over their dominant side, learning how to do that one-handed technique on their non-dominant side. What about the social worker? What might she do?
Check with different companies to see what resources can be brought into the home, what modifications may qualify, and then get that ordered or get the insurance going.
Love it. Thanks, Lauren. All right, PT. Most people are most familiar with PT. What would the PT work on?
Probably mobility training because of her being paralyzed on one side.
Yeah, absolutely. And again, obviously, she's going to want to get back to her luxurious master bedroom and bathroom. So working on that stair.
And she's going to have a assisted device too, because she'll probably go at least cane or walker.
Yes, exactly. Yeah, like a Hemi walker is a lot of times what we see with a stroke, which is a one-sided walker. But yeah, would probably start with some type of wheelchair and then progress to a one-sided Hemi walker. All right, what about speech therapy?
Probably affected by the stroke. Definitely want to work with her, see if it's improving or come up with some alternative form of communication in the interim.
Absolutely. And I think what a lot of people don't know is that the speech therapist also works on the cognitive retraining. So word finding is a lot of times tricky after a stroke. So you know what you want to say, but you can't get it out. So a speech therapist can help with that cognitive retraining to say what you want to say. And then what about the home health aide?
Definitely bathing and helping shower and so forth and dressing.
Yeah, absolutely. What if this patient is like, I can't do anything anymore. I can't get a ride to my doctor's appointments. I need someone to help clean my house and I need 24/7 care. Is that something that we do?
You don't do, but
No.
someone like Tim them do.
Good
And
job.
also they should be documenting what's happening to transfer that information over to the
Absolutely.
clinicians.
Yeah, and we work hand in hand, remember. So like someone can receive OTPT nursing, bill insurance for that while also receiving the home care. So we do that all the time. And yeah, like you said, Lauren, like that transfer of care, Tim and I will send videos to each other. This is how we're doing this transfer. This is how this is working to make sure that it's streamlined in between, both teams going in. Thank y'all for participating. Again, I love presenting in person because I love the participation. So thank y'all for not taking that away. You can go 2 forward. Perfect. So now we're going to talk about just some tips and tricks to stay safe at home. When I meet a new patient, I always say, all right, repeat after me. There's 2 goals of home health. You have to stay off the floor and out of the hospital. Off the floor means you're not falling out of the hospital. Everything gets worse in the hospital. Unless you need a blood transfusion or something crazy, home is safest. So I always say we're going to stay off the floor and out of the hospital. You can click to the next slide. All right, this is so simple, but just wearing the right thing. Especially as we're aging, it is most comfortable for a older adult to just slide on some slippers around the house. You probably wear slippers, your loved ones probably wear slippers. The bad thing about those is they're slippers because they slip. So wearing shoes or socks that have a grip. So the very best thing to wear is like tennis shoes. If that's hard to get on, those horrendous bright yellow hospital socks. I'm sure you've all seen them. They're the very best thing to wear around the home if you cannot get on tennis shoes. So finding something that has a grip You never want to be barefoot. You never want to wear anything that doesn't have a grip. So that's the best thing to wear. Clothes that don't drag. You see these ladies with like gowns that are longer than they are. Total fall hazard. Y'all get that. And then to get dressed seated. As we get older, anytime like you're trying to like put pants on something and you're standing on one leg and not holding on to anything, that's going to be a trip hazard, fall hazard every time. So having having a seat that you can sit on in the master bedroom or in the bathroom is the best thing for sure. Next. You can go to the next slide. Perfect. Okay, set up clear pathways. So as an occupational therapist, when I meet a patient, the first thing that I do is, all right, I want you to give me a tour of your home. So that means they're standing up with their walker, their rollator, or they're propelling their wheelchair, and they're showing me every area of their home that they use. So if you're doing this with a loved one, maybe you're at Thanksgiving and you're asking your mom, your aunt, your spouse to show you around their home, and they're having to sidestep to get through a door, or they're having to go all the way around the living room because there's not a space in between their recliner or the couch. Make note of those things because those things are so easy to fix. So we always say that we want to have a clear pathway everywhere that we use in the home. And then to get rid of those throw rugs. I don't know what it is about older ladies who have random throw rugs all over their home. It is the number one fall hazard. Our walker gets stuck under them. So we definitely want to get rid of all of those throw rugs and make sure all of our floor is easy to go through. And then if you are with someone who has mobility issues or has an upcoming surgery or just getting older, make a task list and knock it out. So anything that you see that's a fall hazard, any bathroom that needs modification, go ahead and do it while you're healthy and while you can do it, because it's better to do it ahead of time than when it's too late. Go to the next one. So we're going to talk about just standing up. It's so simple. But if you're ever with someone who has mobility issues, or you yourself find yourself getting more unstable, the number one thing when you're standing up is to push off from where you're going. So you see a lot of patients trying to like pull up on their walker or to get into a shower through like holding on to a moving door. You always want to push off from where you're going, because a table or a chair isn't going to move, but a walker or maybe a side table or a bathroom door is going to move. Give yourself momentum by rocking. So a lot of times I say, all right, we're going to stand up in 3, and you rock 1, 2, and then you stand up on 3. That momentum is going, and that those verbal cues are really going to help stand up. And then one of the things I see a lot is just like people getting up and going. If you have any kind of blood pressure issues, when you change position, so going from like sitting to standing, that's going to be when you're most dizzy, when you don't have control of your body. So when you stand up, you're always going to want to take a couple breaths before walking. And then obviously lock your brakes. This is both for a rollator and a wheelchair. Making sure anything that you're using is locked before standing up is super ideal. You can go to the next slide. All right, bathroom safety. Number one falls happen getting out of the shower. So we spend a lot of time, especially with OT, setting up a safe bathroom. So number one, metal grab bars, not the suction grab bars. I see patients all the time who are relying on these suction grab bars that are like, oh, I put up grab bars. And then the second time that they use them, it falls as they fall because they're not meant to be permanent. So especially if you own your home, sometimes rental properties, you can go one forward. Sometimes rental properties, you're not allowed to like actually put things into the wall, but if you own your home, always putting in those metal grab bars that are permanent. And then some key pieces of equipment. That first picture on the top left, you can see is a standard shower chair. I always say get a chair that has a back and handles. That way you can push off and really balance. You never want just like a stool or something that doesn't have the back and the sides. The tub transfer bench is the second picture. And one thing that I love about that is it's great for patients who have that old school tub shower combo. That's a lot of the older homes don't have a clear walk-in shower. And if they can't modify the shower, the second set of legs go outside of the shower so they can sit on it and slide down rather than having to step over a big tub shower combo. And then a raised toilet seat with handles is this third picture. So a lot of people, if they don't have a sink right beside their commode, then it's hard to get up and down. So this is just an option to put over so that you have something to stand up from. One thing that is cool is that a doctor, with a doctor's order, a bedside commode is always covered by insurance. It's not something you have to pay out of pocket, whereas like a shower chair is always going to be out of pocket. So if you have someone who cannot afford to pay out of pocket for a shower chair or a specific toilet chair, you can always get a doctor to order the bedside commode, take out the bucket, and you can put that over your toilet as a raised toilet seat, or you can put it in the shower as a shower chair. So that is a little tip that I use for a lot of our patients with lower income who can't afford that out-of-pocket shower chair or toilet chair. Use that given bedside commode, take out the bucket, and you can bring it with you anywhere you go. And then last thing for bathroom safety is to dry off prior to getting out of the shower. So I always say, like, have a towel right there and dry off as much as you can prior to getting out. Because again, the number one source of falls is not getting into the shower, it's getting out of the shower. Go to the next. All right. If y'all have any questions, feel free to ask, but my final thoughts are just spend time with the aging population. I absolutely love older adults. They have so much wisdom. A lot of times when I go in a home, especially if they're a widow or unmarried, I'm the only person that they see all week. So getting to learn their knowledge, they always want to sit down and have coffee or have tea, and they will send me home with food. They are so kind. And then give grace to those who have needs that are different than your own. So when you have someone who's slurring their words or taking too long in the Kroger checkout line or driving 20 miles under the speed limit, you just never know what kind of health, mental or physical things that they're going through, that it is truly just a victory that they're out in the community. So always include them and give them grace. So those are kind of some of my little tidbits on safety and why we exist, how we exist. Does anyone have any questions? Any questions? Any feedback on what home health does or doesn't do?
Yes, I've got a question.
Yes.
I was talking to a customer that was talking about removing rugs, et cetera, like you had suggested.
Mhm.
And one of the things is she practices relaxed falls. And I said, well, how do you actually practice relaxed falling? She said, well, I fall onto my bed, but try to relax. Could I get your comment on that? It seemed a little unusual that you'd practice relaxing falls, and she does that. And she said she was told by somebody, I guess, that if rather than stiffen up as you fall is to kind of like roll with the relaxingness in your body. Could I get you to comment on that?
Yeah. So yeah, the absolute worst thing to do when you fall, which is our instinct, is to put your hand out, because your like smallest, weakest bones are in your hand. So if you like fall on an outstretched arm, you're gonna break those bones. So you really do like try to fall on your shoulder, one of those bigger muscle groups, and roll with it. Obviously, like when you fall, it's pretty quick. So sometimes you don't have that time to plan. But I have worked at a rehab facility, actually it was a rotation in school, where they would not let any patients go home until they could successfully get off the floor, because fall is so common. So once you do fall, the best thing to do is army crawl to a piece of furniture and try to get your way up, or army crawl to a phone that you can call 911. But I've had multiple patients who had a stroke or fell in their home, and they didn't get found for like a day or 2 days because no one knew anything was wrong. They couldn't get to a phone, and it wasn't until someone came and checked on them that they were found on a floor. So definitely, I think learning how to get up from a fall is key. But yes, the safest way to fall is to fall on those big muscle groups and then the army crawl. So
We are running short on time. One more question.
I just wanted to ask, knowing what you know about the body and occupational therapy, what do you suggest people do for preventative? Because I'm sure there's muscle groups or different things as older adults we would benefit from in order to be more resilient.
I hear a lot of like entrepreneurs and people at a desk in this group. So I always say, like, you've got to be on your feet once an hour, and make that absolutely a priority. You've got to be on your feet once an hour, whether that's walking to the bathroom or walking to grab something to drink, or just standing up and stretching your legs, taking a call while walking around. But once an hour, you've got to be up. And then do something that you can do while you age. So whether that's swimming is awesome, golfing, pickleball is getting big because it's a smaller court. Something that you can do during the aging process is huge. And then yeah, the walking up every hour. And then those functional things is the best exercise. So yes, you can go to a gym and do bicep curls or walk on a treadmill, but those functional tasks of bathing yourself, dressing yourself as you get older, it's so easy to just rely on a caregiver or rely on a healthier spouse to do those tasks for you. But I always say, try to do things by yourself prior to asking for help. Have someone there for supervision, for safety, but do those functional tasks. Don't have your spouse make all of your meals because they're healthier. Like, go to the kitchen and do those functional tasks, because that's the best way. That's the absolute best exercise you can do for yourself.
Thank you so much. Thank you so much, Kelsey. What
you.
a great